Hello, I'm Dr. Kaczynski, and this is Plastic Surgery One-on-One, your internet source for plastic surgery questions. Today we're talking about mommy makeovers. So what is a mommy makeover, other than a very clever alliterative term for different surgeries that reverse the effects of pregnancy? In many respects, a mommy makeover is anything you want it to be, because it's a different combination for every person. What we try to do is reverse the effects of pregnancy. One of the unfortunate things about pregnancy, even though everybody loves their kids, they take a toll on women's bodies. When a man has a family, there's really no impact on his body whatsoever, other than he might put on a couple of sympathy pounds when his wife is pregnant. For women, it's completely different. The effects of pregnancy and breastfeeding change their bodies entirely. And it's the type of change that isn't just reversed by going to the gym and losing a couple of pounds. Of all the women that get pregnant, maybe 1% of them can go back to looking the way they did with just going back to the gym. For all the rest of them, there are permanent changes in their breasts, in their abdomen, and in the rest of their body. And those permanent changes can't be reversed without some type of procedure. And the goal here is to get to what I call the PBB, or the pre-baby body. And the way you do that is through a combination of different procedures on the breasts, on the abdomen, and on the body. And as I said, every person has a different combination according to their individual needs. So the first area that we'll talk about is breasts. So what happens with pregnancy and breastfeeding to your breasts? Number one, the breasts fill up. They get engorged with milk. They swell. This causes a number of changes. The skin stretches out, and the breasts also start to sag. If a woman breastfeeds for a long time, my definition of a long time is more than 6 months. If a woman breastfeeds for a long time, the chances of her having sagging and needing to have a lift are much higher. So what happens to the breast is, number one, the pressure of the milk in the ducts actually causes atrophy or shrinkage of the breast tissue, so that after breastfeeding is done, the breast is smaller in the majority of people. Secondly, the weight of the breast that is full of milk for breastfeeding stretches the skin and causes the sagging. If it stays stretched and sagged for long enough, it doesn't shrink back. So, what are the solutions? Number one, augmentation. For women that just have tissue atrophy, loss of breast tissue, which usually shows up as a flattening of the upper part of the breast. So rather than the breast being full like that, it flattens out on top with loss of that tissue. So that's the easiest solution for women that have the mildest problem. The next level is if there's a mild amount of sag or droopiness. This can be fixed with what's called a Benelli lift, or a minimal incision lift. With that type of lift, what we do is we remove skin around the nipple area. The nipple always stays completely attached. And then we put in a purse string suture and tie that up. The effect of that is that it lifts up the breast in mild to moderate cases of sagging. Sometimes we do that with an implant. The next level of sagginess is fixed with what we call a lollipop lift. This is with more pronounced sagging and more drooping, usually from multiple babies or from long periods of breastfeeding. In that lift, we remove skin around the areola, tighten it up the same way, but we also remove some skin down at the bottom, pinching that, so to speak, and that gives you an even bigger lift. The reason it's called a lollipop is that's what the scar looks like. The scar looks like a circular scar, and there's a faint line going down the middle of the breast. That can be done also with or without implants. Lastly, a procedure I often do for more pronounced sagging, or more pronounced ptosis is the more correct term, is a J-lift. So, more atrophy, more sagging, more stretching, and the breast is lower, the nipples are situated lower. We remove it around here, going down, and also where there's usually excess going off to the side to the armpit. The reason that that's called a J-lift is the final scar looks like a J or an L. I prefer the J, so it goes around, down, and across the breast fold. So these are the main corrections that are done on the breasts, and they can be done separately or together with any of the other surgeries that we'll talk about.